We are live back here in studio, and we continue the conversation as we continue to raise awareness when it pertains to breast cancer awareness. All right, joining us this morning is Dr. Asante Blanc, who is the chairman of the Trinidad and Tobago Cancer Society. Good morning and welcome, doctor.
Good morning. Good morning, everybody. Good morning, Trinidad and Tobago.
Thank you for joining us this morning. So we continue the conversation as we are coming close to the end of the month here. But any time is a time to raise awareness about breast cancer and all the other cancers, actually. But we're speaking specifically about breast cancer this morning. So, doctor, first question, what are some of the early signs and symptoms that people can look out for when it comes to breast cancer?
Wow. Okay. So, Carrie, breast cancer, it occurs in mostly women, but I would like men to know that they're also at risk for breast cancer. So, men do have breast tissue as well. Early signs and symptoms of breast cancer include a lump in the breast. It includes a change in size from one breast to the other. You can have a strange rash around the nipple or on the skin of the breast. The texture of the skin of the breast may change. You may have lumps under your arms, which we call adenopathies or lymphadenopathy. A bloody discharge from one nipple, so it's unilateral breast discharge.
Okay.
Retraction of the nipple, so if the nipple is everted, it becomes inverted. So these are and breast pain, like not cyclical, not going with the period, but just constant breast pain are all possible signs and symptoms of breast cancer.
Now, when you these signs and symptoms that you've described, are there anything else that they can be to rule out breast cancer specifically, or is it that you should definitely run with these signs as okay, these are signs and symptoms specifically of breast cancer, and you need to go get checked out for specifically for breast cancer?
Right. So I love that question. No. So these are possible signs and symptoms. Nothing is definite until a biopsy of any lesion confirms breast cancer. So what we're promoting always, not only in October, is screening, and that starts with monthly breast exams, self breast examination, an annual clinical breast exam, and the mammograms from age 40 and or the breast ultrasound, which may be done in conjunction, because then these will allow us to evaluate what you're feeling. So if you feel a lump, let's say, Kerry,
Right.
then you go to your family physician, they will work it up, they will do some imaging, most likely an ultrasound, and then we would move from there to determine if this is malignant or cancer or a benign tumor, because we do have benign, which are non-cancerous tumors of the breast as well.
Now, you said self-examination. Could you describe for us how women at home can do at least their primary and initial self-examination, just in case, before they go toward seeing a physician and these things?
Right. So your self breast examination should be done monthly, and it should be done about 5 days after your period has ended. So what we recommend is that women, first of all, well, obviously you're naked and you're looking in the mirror to look at both breasts to see that they are more or less symmetrical. They'll never be absolutely identical. So you look at the symmetry of the breast, you look to see the skin, any rashes, any strange, if the nipple is going in or anything. And then after that, they can lie down, and then the breast they're going to examine, that hand goes above their head or behind their neck. And then with the pads of the other hand, they will then slowly palpate the breast from outward going in a clockwise or anti-clockwise direction, coming towards the nipple, which they'll then squeeze. And then you go under the arm to feel for any lumps. And
Right.
that's a simple self breast examination.
And when you escalate, the testing and these things, and you go to a physician, what is the first line, what is the first line of testing or examination the physician would do?
So let's say you are, I don't know, let's say you're 30 years old, Carrie, and you felt a lump and you've been feeling that lump over the months during your self breast examination, and you're not comfortable. You go to your family doctor, and the doctor will first of all ask you the questions in terms of your family history, about your period. Are you on any medication, anything different, and so forth. They'll do a complete medical interview. And then they should do a clinical breast examination.
Right.
After that, if once the doctor does the clinical breast examination, he or she should send you for a breast ultrasound, depending on your age. Because if you're over 40 and haven't had your annual mammogram, then the chances are they will send you for both the mammogram and the ultrasound. After that, it will be worked up. If we see a lump, if we see a lesion on those tests, then we will send you for further testing. Could it be a spot compression on the mammogram, or we can do biopsies or true cut biopsies?
Now, you mentioned earlier that women 40 or over should start going to get mammograms. Um, what about those younger than 40? What should they be doing? And is it recommended, you know, even at the age of, let's say, 35 or so, to still, just in case, go get a mammogram done? Doctor, are you with me? All right, it seems a window is frozen there. Hopefully we can connect a little bit so we could get just the end of that interview there. But that was Dr. Asante LeBlanc?
Yes, I'm here.
Okay, good. Yeah, we lost you for a little bit there. So the question was, you did mention earlier that, you know, women should start getting mammograms from the age of 40. But is there any benefit to getting it before the age of 40?
It depends on your family history. So we recommend that if you feel a lump or you have a very strong family history of breast cancer, you must go to your physician and have your annual clinical breast examinations. And then he or she will determine when you need to start your mammograms and or breast ultrasounds.
Okay, wonderful. And with that, I want to thank you for giving us this information this morning. You never know who it would have helped this morning, but I want to say thank you so much, Dr. Asante LeBlanc, Chairman of the Trinidad and Tobago Cancer Society, for joining us this morning and giving us this very important information as we continue our conversations as pertains to breast cancer awareness. All right, have a great morning.